Hi everyone, it's Dr. Mazar from Men's Medical Clinic in Leeds. We're a specialist TRT clinic. So when does TRT become dangerous for the patient? So I'm going to talk about a couple of scenarios where TRT can become dangerous for the patient. So number one, if you're not monitoring your TRT, if you're not doing regular blood testing, if you're not monitoring your blood pressure, if you're not speaking to a doctor or medical professional regularly, then potentially TRT could become dangerous. You could miss issues such as blood pressure problems, hypertension, haematocrit problems, so blood thickness, which potentially could lead to clots if it's not monitored properly. And then lots of other issues in terms of cardiovascular health, estrogen, liver functions. All these things need to be monitored, not just specifically related to TRT, but generally as part of your metabolic health profile. So number two is if your focus is on building muscle rather than being healthy, then this can be very dangerous when you're doing TRT. So probably it shouldn't be called TRT at that stage because it is bodybuilding. But if you're doing doses such as 250 milligram a week, then you're not on TRT, you are basically bodybuilding or chasing the buzz that you can get from high levels of testosterone. So the problem is when you're focusing on bodybuilding, muscle building, you probably are not looking after your health as well as you should be, particularly in the long term, because you could be okay doing that for a couple of years, but eventually it will catch up with you in terms of hypertension, cardiac hypertrophy. All these issues can happen. Number three, in a similar vein, if you're going way above physiological levels, in a similar vein to bodybuilding, then you will eventually get some problems. So once again, blood pressure problems, hematocrit problems. The main issue is with TRT, we know overall it's very, very safe long term in terms of cardiovascular health, prostate health, liver functions, blood counts. But the problem is if you're going way above physiological levels, all the TRT studies and research that we do then doesn't apply to you anymore. We have no idea what happens if your testosterone is at 50 nanomoles per litre for 20 or 30 years. I can't tell you as a patient that that is safe for you long term. So these are the three things that you need to be doing to make sure that you're safe on TRT and avoid any dangerous complications or side effects. I hope that was helpful. You can check us out at www.mensmedicalclinic.co.uk or send me an email on info@mensmedicalclinic.co.uk.